to express their own insecurities. Understanding this function can help the couple work through their communication issues and develop healthier ways to express feelings. Summary: relying on symptoms function is a therapeutic approach that focuses on understanding the role that certain behaviors or symptoms play in a person's life. By analyzing these functions, therapists can uncover underlying issues and promote healthier behaviors. This holistic perspective encourages collaboration between therapists and clients, leading to more effective solutions and lasting change. Understanding this concept is valuable for anyone studying psychology or preparing for the CPC exam, as it highlights key strategies in therapy that focus on the deeper meaning behind symptoms. Incongruous hierarchy. A simple explanation. What is incongruous hierarchy? Incongruous hierarchy is a concept often discussed in family therapy and systems theory. It refers to a situation where the roles and power dynamics within a family or group are mismatched or inconsistent. This can lead to confusion, conflict, and dysfunction within the family system. Essentially, it describes a scenario where the expected order of authority or responsibility is disrupted. Key concepts. 1. Hierarchy in families. In any family, there is typically a hierarchy, which means that some members have more authority or decision-making power than others. For example, parents usually have more authority than their children. This hierarchy helps maintain order and structure within the family. 2. Incongruity. The term incongruous means something that is out of place or does not fit well with something else. When applied to hierarchy, it indicates that the expected power dynamics are not functioning as they should. For example, if a child is making all the important decisions in the family, this creates an incongruous hierarchy. 3. Impact on family dynamics. An incongruous hierarchy can lead to confusion and conflict among family members. When roles are unclear or authority is misplaced, it can create tension and misunderstandings. For example, if a teenager takes on a parental role, the parent may feel undermined, leading to resentment and conflict. 4. Examples of incongruous hierarchies. There are different ways in which incongruous hierarchies can manifest in families. Parentification. This occurs when a child takes on responsibilities that belong to a parent, such as caring for younger siblings or making decisions for the family. This can lead to stress and anxiety for the child, who is not emotionally prepared for such roles. Role reversal. This happens when the expected roles of parents and children are swapped. For instance, an adult child may feel compelled to take care of their aging parents, which can create feelings of frustration and inadequacy in the parents. 5. Therapeutic approach. In therapy, addressing incongruous hierarchies is important for restoring balance within the family. Therapists work with families to clarify roles and responsibilities, helping to reestablish a more functional hierarchy. This can involve encouraging parents to take on their appropriate roles and guiding children to step back into their expected positions. Important details. Communication issues. Incongruous hierarchies often arise from poor communication among family members. When expectations are not clearly expressed or understood, roles can become confused. Encouraging open and honest communication is essential for resolving these issues. Cultural considerations. Different cultures have varying expectations regarding family hierarchies and roles. It's important for therapists to understand these cultural contexts when working with families to address incongruous hierarchies. Long-term effects. If incongruous hierarchies are not addressed, they can lead to ongoing dysfunction within the family. This may result in emotional distress, behavioral problems, and difficulties in relationships outside the family. Examples to illustrate the concepts. Example of parentification. A 10-year-old child might take on the role of caregiver for their younger siblings because their parents are often busy with work or personal issues. This child may miss out on their own childhood experiences, feeling overwhelmed by responsibilities that are not appropriate for their age. Example of role reversal. An adult child may find themselves managing their parents' finances and making decisions about their care due to the parents' inability to do so. This role reversal can create tension, as the parents may feel inadequate or resistant to being cared for by their child. Example of conflicting authority. In a family where the mother is overly permissive and the father is very strict, the children may become confused about which parent's rules to follow. This incongruity can lead to behavioral problems, as the children may manipulate situations to get what they want from either parent. Summary: incongruous hierarchy refers to a situation in which the expected roles and power dynamics within a family or group are disrupted or mismatched. This can lead to confusion, conflict, and dysfunction among family members. Understanding this concept is important in therapy, as it helps address communication issues and restore balance within the family. By clarifying roles and responsibilities, families can work towards healthier dynamics and improve their overall well-being. This knowledge is valuable for anyone studying psychology or preparing for the CPC exam, as it highlights the complexities of family relationships and the importance of functional hierarchies. Prétend technique à simple explanation. What are pretend techniques? Pretend techniques are therapeutic strategies used in counseling and therapy, particularly in family therapy and child therapy. These techniques involve using imagination and role-playing to help clients explore their feelings, understand their situations better, and develop new ways of coping with problems. By pretending to be someone else or acting out different scenarios, clients can gain insights into their behaviors and relationships. Key concepts. 1. Role-playing. One of the main components of pretend techniques is role-playing. In role-playing, clients act out different roles or situations to better understand their own emotions and behaviors. For example, a child might pretend to be a parent to explore their feelings about family dynamics. 2. Imagination and creativity. Pretend techniques utilize the imagination and creativity of clients. This playful approach can make therapy feel less intimidating and more engaging, especially for children. By using their imagination, clients can express thoughts and feelings that they might find difficult to articulate in traditional conversation. 3. Exploration of feelings. These techniques allow clients to explore their feelings in a safe and controlled environment. For instance, a teenager might pretend to confront a friend about a conflict, helping them understand their feelings of anger or hurt without the real-life consequences of the confrontation. 4. Insight and understanding. By acting out different scenarios, clients can gain insights into their behaviors and relationships. They may discover patterns in their actions or recognize how their feelings influence their interactions with others. For example, a person might realize they avoid conflict in real life because they fear rejection, which they can explore through pretend techniques. 5. Therapeutic goals. The ultimate goal of using pretend techniques is to help clients develop new coping strategies and improve their relationships. By gaining insights through role-playing, clients can learn how to express themselves better, resolve conflicts, and manage their emotions more effectively. Important details. Used with children. Pretend techniques are particularly effective with children who may struggle to express their feelings verbally. By using play and imagination, therapists can help children communicate their thoughts and emotions in a more comfortable way. Cultural sensitivity. When using pretend techniques, therapists need to be aware of cultural differences. Some cultures may have different views on role-playing or imaginative play, so it's important to respect those perspectives while facilitating therapy. Flexibility in techniques. Therapists can adapt pretend techniques to fit the needs of their clients. This flexibility allows for a personalized approach, making therapy more relevant and effective for each individual. Examples to illustrate the concepts. Example of role-playing. In a session, a therapist might ask a child to pretend to be their parent while the therapist takes on the role of the child. The child can then express their feelings about the parent's rules or expectations, helping them understand their perspective better. Example of exploring conflict. A teenager might role-play a scenario where they have a disagreement with a friend. By acting out the conversation, they can practice using assertive communication and learn how to express their feelings without escalating the conflict. Example of imagination in therapy. A therapist might ask a client to imagine they're a superhero who can overcome any challenge. The client can explore their strengths and how they would handle difficult situations, helping them build confidence and resilience in real life. Summary. Pretend techniques are therapeutic strategies that use imagination and role-playing to help clients explore their feelings, understand their behaviors, and develop new coping strategies. By engaging in role-playing, clients can gain insights into their relationships and learn how to communicate more effectively. These techniques are especially useful for children, but can be beneficial for individuals of all ages. Understanding pretend techniques is valuable for anyone studying psychology or preparing for the CPC exam, as they demonstrate innovative approaches to therapy that foster self-awareness and emotional growth. Restraining, a simple explanation. What is restraining? In the context of therapy and psychology, restraining refers to actions or techniques used to manage or control certain behaviors, emotions, or situations. It can involve setting limits on behaviors that are harmful or disruptive, helping individuals learn how to cope with their feelings or actions more effectively. Restraining is not just about physical control. It often includes emotional and psychological aspects as well. Key concepts. 1. Behavior management. Restraining can be seen as a way to manage behaviors that are inappropriate or harmful. For example, if a child is acting out aggressively, a therapist or caregiver might use restraining techniques to help the child calm down and learn more appropriate ways to express their feelings. 2. Setting boundaries. In therapy, restraining often involves setting clear boundaries for clients. This means establishing rules or limits that help individuals understand what behaviors are acceptable and what are not. For instance, a therapist might explain that yelling during sessions is not allowed, helping clients learn to communicate in a more respectful way. 3. Emotional regulation. Restraining is also related to helping individuals regulate their emotions. This can involve teaching clients techniques to manage their feelings, such as deep breathing, mindfulness, or grounding exercises. By learning these techniques, individuals can restrain their emotional responses in challenging situations. 4. Physical restraint. In some cases, restraining can refer to physical methods used to prevent someone from harming themselves or others. This is often seen in crisis situations, where a person may be a danger to themselves or those around them. It's important to note that physical restraint should only be used as a last resort and by trained professionals, as it can lead to trauma or further issues if not handled properly. 5. Therapeutic goals. The goal of restraining techniques is not to control or dominate individuals, but to help them develop healthier coping mechanisms and improve their behaviors. By providing structure and support, therapists can guide clients toward positive change. Important details. Crisis situations. In a mental health crisis, restraining may be necessary to ensure safety. However, it should always be done with care and respect for the individual's dignity. Alternatives, such as verbal de-escalation or providing a calm environment, should be prioritized whenever possible. Cultural context. Different cultures may have varying views on restraint and control. It's crucial for therapists to be aware of these cultural differences and to approach restraining with sensitivity and respect for the client's background. Communication. Open communication is essential when using restraining techniques. Clients should understand why certain behaviors are being limited and how those limits can help them in the long run. This understanding fosters trust and collaboration between the client and the therapist. Examples to illustrate the concepts. Example of behavior management. A teacher notices that a student becomes disruptive during group activities. To restrain this behavior, the teacher might implement a system where the student is given a warning before losing privileges, such as sitting out of the activity. This helps the student learn appropriate ways to participate without disrupting others. Example of setting boundaries. In therapy, a client may express anger by shouting. The therapist might say, "I understand you're upset, but we need to talk calmly. If you continue to shout, we will take a break." This sets a boundary and encourages the client to find healthier ways to express their emotions. Example of emotional regulation. A teenager struggling with anxiety might learn to use deep breathing techniques when feeling overwhelmed. By practicing these techniques, the teenager can restrain their anxiety response, allowing them to better cope with stressful situations. Summary. Restraining in therapy refers to managing behaviors, emotions, and situations by setting limits and teaching coping strategies. It involves behavior management, emotional regulation, and sometimes physical restraint in crisis situations. The goal is to help individuals develop healthier ways to handle their feelings and actions. Understanding the concept of restraining is important for anyone studying psychology or preparing for the CPC exam, as it highlights essential techniques for promoting positive change in therapy and supporting individuals in their personal growth. Positioning, a simple explanation. What is positioning? In the context of therapy and counseling, positioning refers to the way therapists or counselors set up the dynamics in a therapeutic session to influence how clients perceive their problems and interact with each other. It involves establishing roles, boundaries, and relationships within the therapy process to facilitate change and understanding. Positioning can significantly impact how effectively therapy works. Key concepts. 1. Therapist role. The therapist plays a crucial role in positioning because they guide the flow of the session and influence the interactions between clients. For example, a therapist might position themselves as a facilitator, encouraging clients to express their feelings openly, or as a mediator, helping to resolve conflicts between family members. 2. Client dynamics. Positioning also involves understanding how clients relate to one another. In family therapy, for example, the therapist may need to be aware of alliances and conflicts among family members. By positioning themselves appropriately, the therapist can help shift these dynamics to promote healthier relationships. 3. Creating safety. Effective positioning helps create a safe environment where clients feel comfortable sharing their thoughts and feelings. This can involve physical positioning, such as arranging chairs in a circle to foster openness, or emotional positioning, where the therapist validates clients' feelings and experiences. 4. Influencing perception. Positioning can change how clients perceive their problems and relationships. For example, a therapist might encourage a client to see a conflict with a family member from a different perspective, helping them understand the other person's feelings and motivations. This shift can lead to new insights and solutions. 5. Setting boundaries. Positioning also includes establishing clear boundaries in therapy. This means defining what is acceptable behavior during sessions. For example, if a client is interrupting others, the therapist might position themselves to address this behavior directly, reinforcing respectful communication. Important details. Cultural sensitivity. Positioning should take into account the cultural backgrounds of clients. Different cultures may have varying expectations about authority, communication styles, and family dynamics. A therapist should be aware of these differences to position themselves effectively. Flexibility. A good therapist is flexible in their approach to positioning. Depending on the needs of the clients, they may need to adapt their style and techniques throughout the therapy process. This adaptability can enhance the effectiveness of the sessions. Therapeutic goals. The ultimate goal of positioning is to facilitate healing and growth. By carefully managing the dynamics in therapy, the therapist can help clients develop better understanding, communication, and relationships. Examples to illustrate the concepts. Example of therapist's role. In a family therapy session, a therapist may notice that one parent dominates the conversation while the other stays quiet. To change this dynamic, the therapist might position themselves to ask the quieter parent for their opinion directly, encouraging them to share their thoughts. Example of creating safety. If a client feels anxious about discussing a traumatic experience, the therapist might position themselves in a way that feels less intimidating, such as sitting next to the client rather than across from them, to create a sense of safety and support. Example of influencing perception. During a session, if two siblings are arguing about their childhood, the therapist might position themselves to help each sibling express their feelings about the situation. By doing this, they can help each sibling understand the other's perspective, leading to greater empathy and resolution. Summary. Positioning in therapy involves the ways therapists manage the dynamics within a session to influence how clients interact and perceive their problems. It includes the therapist's role, client dynamics, creating a safe environment, influencing clients' perceptions, and setting boundaries. Understanding the concept of positioning is important for anyone studying psychology or preparing for the CPC exam, as it highlights essential strategies for effective therapy and promoting positive change in clients' lives. Action-oriented, symptom-focused therapy, a simple explanation. What is action-oriented, symptom-focused therapy? Action-oriented, symptom-focused therapy is a therapeutic approach that emphasizes taking specific actions to address and manage symptoms of distress or dysfunction in a person's life. This type of therapy is practical and solution-driven, focusing on identifying and alleviating specific problems rather than delving deeply into underlying issues or past experiences. Key concepts. 1. Focus on symptoms. In this approach, the therapist concentrates on the symptoms that the client is experiencing. For example, if a client is dealing with anxiety, the RAP will focus on reducing that anxiety in concrete ways, like developing coping strategies or changing thought patterns. 2. Action-oriented approach. This therapy encourages clients to take immediate action to manage their symptoms. This means that instead of just talking about problems, clients are guided to engage in specific activities or behaviors that can help improve their situation. The idea is to empower clients to make changes that can lead to relief from their symptoms. 3. Goal setting. Action-oriented, symptom-focused therapy often involves setting clear, achievable goals. Clients and therapists work together to identify what specific outcomes the client wants to achieve, such as reducing panic attacks or improving social interactions. These goals guide the therapy process. 4. Practical techniques. Therapists may use various practical techniques to help clients manage their symptoms. These can include cognitive behavioral strategies, relaxation techniques, exposure therapy, or skills training. For instance, if a client has social anxiety, the therapist might create a step-by-step plan for gradually facing social situations. 5. Measurable progress. This approach allows for measurable progress, as clients can see changes in their symptoms over time. By regularly evaluating how well the strategies are working, both the client and therapist can adjust the approach if necessary. Important details. Short-term focus. Action-oriented, symptom-focused therapy is often used in short-term therapy settings. The goal is to provide quick relief and practical solutions to immediate problems rather than exploring long-term psychological issues. Collaboration. This approach is very collaborative. The therapist and client work together as a team, with the therapist providing guidance and the client actively participating in their own healing process. Empowerment. A key aspect of this therapy is empowering clients to take control of their symptoms. By actively engaging in the process and seeing results, clients can build confidence in their ability to manage their challenges. Examples to illustrate the concepts. Example of addressing anxiety. If a client is experiencing anxiety attacks, the therapist might work with them to develop a plan that includes deep breathing exercises, mindfulness techniques, and gradually exposing the client to situations that trigger their anxiety. This action-oriented approach helps the client reduce their anxiety symptoms directly. Example of managing depression. For a client dealing with depression, the therapist might set a goal for the client to engage in physical activity 3 times a week. The therapist would provide support and encouragement while the client takes action to improve their mood through exercise, which has been shown to help alleviate symptoms of depression. Example of improving communication. If a client is struggling with communication in relationships, the therapist may focus on teaching specific communication skills, such as active listening or assertiveness training. The client then practices these skills in real-life situations to see improvement in their interactions. Summary. Action-oriented, symptom-focused therapy is a practical approach that concentrates on identifying and managing specific symptoms through active participation and measurable goals. This method empowers clients to take action to improve their situations, making it effective for addressing immediate concerns. Understanding this approach is valuable for anyone studying psychology or preparing for the CPC exam, as it highlights essential strategies for helping clients achieve relief and make meaningful changes in their lives. Premack's Principle, a simple explanation. What is Premack's Principle? Premack's Principle is a concept in psychology that explains how to use more preferred activities to encourage less preferred activities. It is based on the idea that if you want someone to do something they don't particularly enjoy, you can motivate them by allowing them to engage in an activity they do enjoy afterward. It's often summarized as first, do this, then you can do that. Key concepts. 1. Preferred versus less preferred activities. In Premack's principle, activities are divided into two categories. Preferred activities. These are activities that a person enjoys and is motivated to do. For example, playing video games, going out with friends, or eating dessert. Less preferred activities. These are tasks that a person finds less enjoyable or may even dislike. Examples include doing homework, cleaning their room, or completing chores. 2. Motivation through reinforcement. The principle suggests that you can use the reward of a preferred activity as a reinforcement to encourage the completion of a less preferred activity. For instance, if a child knows they can play video games after finishing their homework, they may be more motivated to complete the homework. 3. Behavior modification. Premack's principle is often used in behavior modification strategies, especially in educational settings or parenting. By structuring tasks in this way, teachers and parents can help children develop better habits and learn to tackle responsibilities. 4. Real-life applications. This principle can be applied in various situations, including at home, in schools, and even in workplaces. It can be a useful strategy for teaching self-discipline and time management. 5. Underlying psychology. The principle is based on the idea of natural reinforcement. When a preferred activity follows a less preferred one, it creates a positive association, making it more likely that the less preferred activity will be completed in the future. Important details. Individual preferences. What is considered a preferred activity can vary from person to person. It's essential to know what activities are motivating for the individual to effectively apply Premack's principle. Gradual implementation. For Premack's principle to work effectively, it may be necessary to start with smaller tasks and gradually increase the difficulty of the less preferred activities as the person becomes more motivated. Avoiding overuse. While this principle can be very effective, it's important not to overuse it. If every task becomes a negotiation for a reward, it may lead to decreased motivation over time. Balance is key. Examples to illustrate the concepts. Example with homework. A parent might tell their child, if you finish your math homework, you can watch your favorite TV show afterward. Here, the act of finishing the homework is the less preferred activity, and watching TV is the preferred reward. Example in the classroom. A teacher might say, if you complete your reading assignment, you can choose a fun game to play with the class. The reading assignment is the less preferred task, while the game is the preferred activity. Example with chores. A teenager might be encouraged to clean their room by their parents saying, if you clean your room, you can go out with your friends later. Cleaning the room is the less preferred activity, and going out is the preferred one. Summary. Premack's principle is a psychological concept that uses preferred activities as motivation to encourage less preferred activities. By allowing someone to engage in an enjoyable task after completing a less enjoyable one, you can effectively motivate them to take on responsibilities. This principle can be applied in various contexts, such as parenting and education, to help individuals develop positive behaviors and complete necessary tasks. Understanding Premack's principle is useful for anyone studying psychology or preparing for the CPC exam, as it highlights an effective strategy for behavior modification and motivation. Quid pro quo, a simple explanation. What is quid pro quo? Quid pro quo is a Latin term that means something for something. In simple terms, it refers to an arrangement where one thing is given in exchange for another. This concept is commonly used in various contexts, including legal, business, and interpersonal relationships. Key concepts. 1. Exchange of benefits. The fundamental idea behind quid pro quo is that there is a mutual exchange. One party provides a benefit, service, or favor to another party, and in return, they receive something of equal value. This can be tangible or intangible. 2. Common usage. Quid pro quo is often mentioned in discussions about negotiations, agreements, and contracts. It can appear in business deals where one company offers a service in exchange for another service or payment. 3. Legal context. In the legal field, quid pro quo is often discussed in relation to employment and sexual harassment cases. For example, if a boss offers a promotion to an employee in exchange for sexual favors, this is considered a quid pro quo situation and is illegal. 4. Power dynamics. Quid pro quo arrangements can involve power dynamics, especially in situations where one party holds more power than the other. For instance, in a workplace setting, a supervisor may be in a position to offer rewards to subordinates in exchange for compliance or favors. 5. Ethical considerations. While quid pro quo arrangements can be legitimate and beneficial, they raise ethical concerns when they involve manipulation or coercion. It's essential that both parties enter into the agreement willingly and without undue pressure. Important details. Legitimacy. For a quid pro quo arrangement to be considered legitimate, both parties must agree to the terms and understand what they are exchanging. This mutual consent is crucial. Potential for misuse. Quid pro quo can be misused in situations where there is an imbalance of power. For example, an employee may feel pressured to comply with inappropriate demands to keep their job or gain a promotion. Need for clarity. Clarity in the terms of the exchange is important to prevent misunderstandings. Both parties should clearly outline what they are offering and what they expect in return. Examples to illustrate the concepts. Example in business. A company might offer a discount on its products to a retailer in exchange for the retailer agreeing to promote the company's brand more prominently in their store. Here, the discount is the quid and the promotion is the quo. Example in employment. An employee may agree to take on extra work for a colleague in exchange for that colleague covering their shift at a later date. This arrangement benefits both parties and is a simple example of quid pro quo. Example of misuse. In a workplace, if a manager tells an employee that they will receive a bonus if they agree to go on a date with them, this is a problematic quid pro quo situation. The employee might feel pressured to comply because of the power the manager holds over their job. Summary. Quid pro quo means something for something and refers to an exchange where one party provides a benefit in return for another benefit. It is commonly used in business, legal contexts, and interpersonal relationships. Understanding quid pro quo is important because it highlights the dynamics of exchange and the potential ethical issues that can arise, especially in situations where there is a power imbalance. This knowledge is useful for anyone studying psychology or preparing for the CPC exam, as it helps in recognizing the complexities of social interactions and agreements. Behavior modification, a simple explanation. What is behavior modification? Behavior modification is a psychological technique that aims to change specific behaviors through various methods. It is based on the idea that behaviors can be learned and unlearned, meaning that by using certain strategies, people can change their actions, reactions, and habits. This approach is commonly used in education, therapy, and various settings where behavior change is desired. Key concepts. 1. Reinforcement. One of the main principles of behavior modification is reinforcement. This refers to using rewards to encourage desired behaviors. Positive reinforcement involves giving a reward when a person exhibits a behavior you want to encourage. For example, a teacher might give students stickers for completing their homework on time. 2. Punishment. Another important concept is punishment, which involves applying a negative consequence to reduce or eliminate an undesired behavior. There are two types of punishment. Positive punishment, adding an unpleasant consequence after a behavior. Negative punishment, removing a pleasant experience following a behavior. 3. Behavioral goals. Behavior modification often involves setting specific goals for what behaviors need to change. These goals should be clear and achievable. For example, a goal might be to reduce a child's tantrums by teaching them alternative ways to express frustration. 4. Observing and measuring behavior. To effectively modify behavior, it's important to observe and measure the behavior you want to change. This helps in understanding the frequency and context of the behavior. For instance, a therapist might track how often a client engages in negative self-talk to identify patterns and triggers. Techniques used. Various techniques can be used in behavior modification, including shaping, gradually reinforcing behaviors that are closer to the desired behavior. For example, if a child is learning to write, the teacher might first reward them for just holding the pencil correctly before moving on to writing letters. Modeling, demonstrating the desired behavior so that the individual can learn by example. For instance, a parent might show a child how to say please and thank you before expecting them to do it. Important details. Individual differences. Every individual is unique, and what works for one person may not work for another. It's important to tailor behavior modification techniques to fit the specific needs and preferences of the individual. Ethical considerations. Behavior modification should always be used ethically. It's important to ensure that the methods used are respectful and do not cause harm to the individual. For example, using excessive punishment can lead to negative feelings and resentment. Long-term change. The goal of behavior modification is not just to change behavior temporarily, but to create lasting change. This often requires ongoing reinforcement and support to help maintain the new behaviors. Examples to illustrate the concepts. Example in education. A teacher wants to encourage students to participate more in class discussions. She might implement a system where students earn points for every time they contribute. Once they reach a certain number of points, they can choose a reward like extra recess time. Example in parenting. A parent notices that their child throws tantrums when they don't get their way. To modify this behavior, the parent decides to reward the child with praise and a small treat whenever they express their feelings calmly instead of throwing a fit. Over time, the child learns to use words to express frustration. Example in therapy. A therapist working with a client who struggles with procrastination might help the client set a goal of working for 25 minutes and then taking a 5-minute break as a reward. This structured approach helps the client gradually develop better time management skills. Summary. Behavior modification is a method used to change specific behaviors through reinforcement and punishment. It involves setting clear goals, observing behaviors, and using various techniques to encourage positive changes. By understanding the principles of behavior modification, individuals can learn to manage their actions and develop healthier habits. This knowledge is useful for anyone studying psychology or preparing for the CPC exam, as it provides essential strategies for promoting positive behavior change in various contexts. Baseline, a simple explanation. What is a baseline? In psychology and behavioral science, a baseline refers to the initial measurement or observation of a particular behavior or condition before any intervention or treatment is applied. It serves as a reference point to evaluate changes over time. Understanding the baseline helps researchers, therapists, and practitioners assess the effectiveness of their strategies or treatments. Key concepts. 1. Initial measurement. The baseline is essentially the starting point. It provides a clear picture of the current state of a behavior or condition. For example, if a therapist is working with a client on reducing anxiety, they would first measure the client's anxiety levels before starting any treatment. 2. Tracking changes. By establishing a baseline, professionals can track how much a behavior has changed after implementing an intervention. This allows them to see if the strategies they're using are effective. For instance, if a teacher wants to improve student participation in class, they might record how often each student speaks before any new strategies are introduced. 3. Evaluation of effectiveness. The baseline data helps in evaluating the success of a treatment or intervention. After measuring the baseline, practitioners can compare it with future measurements to determine if there has been an improvement. For example, if a child's baseline level of tantrums is recorded at 10 instances a week, and after implementing a behavior modification plan, the tantrums drop to 3 instances a week, this shows the plan is working. 4. Goal setting. Establishing a baseline can help in setting realistic goals. It gives a clear understanding of where an individual currently stands, which can inform what goals are achievable. For example, if a person wants to increase their daily exercise from a baseline of 10 minutes a week, they could set a goal to increase it gradually based on their starting point. 5. Importance in research. In research studies, establishing a baseline is crucial for measuring the impact of experimental treatments. Researchers often compare the baseline data of a control group with that of an experimental group to assess the effects of an intervention. Important details. Consistency in measurement. For the baseline to be useful, it must be measured consistently. This means using the same methods and conditions each time to ensure accurate comparisons. Variability. Individual differences can affect baseline measurements. Factors such as mood, environment, and physical health can lead to variations in behavior. It's important to consider these factors when interpreting baseline data. Time frame. The baseline can be measured over different time frames depending on the behavior being studied. It could be a single observation or gathered over several days or weeks to get a more accurate picture. Examples to illustrate the concepts. Example in therapy. A therapist working with a client who wants to reduce their smoking might first assess how many cigarettes the client smokes in a week. This number serves as the baseline. After the client starts a quit plan, the therapist can compare future weeks to this baseline to see how effective the plan is. Example in education. A teacher wants to improve reading skills in a class. Before starting a new reading program, the teacher measures each student's reading level. This initial assessment is the baseline. After several weeks of the program, the teacher can assess the students again to see how much their reading levels have improved compared to the baseline. Example in health. A fitness trainer may track a client's baseline physical fitness by measuring how far they can run in 12 minutes. After following a training program for several months, the trainer can measure the same running distance again to see if the client has improved. Summary. A baseline is an initial measurement of a behavior or condition used to track changes over time. It serves as a reference point for evaluating the effectiveness of interventions and helps in setting realistic goals. By understanding the concept of a baseline, individuals studying psychology or preparing for the CPC exam can appreciate its importance in assessing progress and the impact of treatment strategies. Timeout, a simple explanation. What is timeout? Timeout is a behavioral technique used to manage and modify undesirable behaviors, particularly in children. It involves temporarily removing a person from a situation where they are misbehaving or acting inappropriately. The idea is to give the individual a break from the environment to help them calm down and reflect on their actions. Key concepts. 1. Behavior management. Timeout is primarily used as a disciplinary strategy to address behaviors like tantrums, aggression, or defiance. It helps to interrupt these behaviors and allows the individual to regain control over their emotions. 2. Temporary removal. During a timeout, the individual is usually removed from a stimulating environment and placed in a quieter, less distracting space. This removal is not meant to be a punishment, but rather a way to help the person calm down and think about their behavior. 3. Duration and consistency. The length of a timeout should be appropriate for the individual's age and the severity of the behavior. A common guideline is 1 minute of timeout for each year of the child's age. For example, a 5-year-old might have a timeout lasting about 5 minutes. 4. Clear communication. Before implementing a timeout, it's important to clearly explain to the individual why they are being given a timeout. This helps them understand the connection between their behavior and the consequence. For instance, a parent might say, "You're going to have a timeout because you hit your brother." 5. Post-timeout discussion. After the timeout is over, it's helpful to talk about what happened. This discussion should focus on understanding the behavior, discussing better choices for the future. It reinforces the learning aspect of the timeout. Important details. Not a punishment. Timeout should not be used as a harsh punishment. Instead, it should be viewed as a moment for the individual to cool down and reflect on their actions. The goal is to teach rather than to punish. Setting up a timeout space. It's important to establish a specific area for timeouts that is safe and free from distractions. This could be a designated chair or a quiet corner in the room. The space should not be frightening or uncomfortable. Effectiveness. Timeout can be effective in reducing unwanted behaviors if used consistently and appropriately. However, it may not work for every child or situation, and other strategies may need to be considered. Examples to illustrate the concepts. Example in parenting. If a child is throwing a tantrum in the store because they want a toy, a parent might say, "We're going to have a timeout in the car for a few minutes until you calm down." The child is then taken to the car, where they sit quietly for a few minutes to regain composure. Example in school. A teacher notices that a student is being disruptive during class. The teacher might say, "You need to take a timeout in the hallway for a few minutes to think about how to behave in class." The student steps out and takes a moment to reflect on their actions. Example of post-timeout discussion. After a child has a timeout for hitting a sibling, a parent might sit down with them afterward and say, "I notice you were upset, but hitting is not okay. Next time, let's try using words to express how you feel instead. Summary. Timeout is a behavioral technique used to manage undesirable behaviors by temporarily removing an individual from a situation where they misbehave. It allows them to calm down and reflect on their actions. Timeout should be implemented as a teaching tool rather than a punishment, with clear communication and follow-up discussions to promote better behavior in the future. Understanding the concept of timeout is useful for anyone studying psychology or preparing for the CPC exam, as it provides practical strategies for behavior management in various settings. Systematic desensitization, a simple explanation. What is systematic desensitization? Systematic desensitization is a therapeutic technique developed by psychologist Joseph Wolpe to help people overcome fears and phobias. It is based on the idea that you can reduce anxiety by gradually exposing someone to the source of their fear in a controlled and relaxed manner. This process helps individuals learn to cope with their anxiety and eventually reduce their fear responses. Key concepts. 1. Anxiety and fear. Systematic desensitization is primarily used to treat anxiety disorders, such as phobias. A phobia is an intense, irrational fear of a specific object or situation, like spiders, heights, or public speaking. When someone with a phobia encounters the feared object or situation, they often experience overwhelming anxiety. 2. Relaxation techniques. Before starting the exposure process, individuals learn relaxation techniques to help them manage their anxiety. Common methods include deep breathing exercises, progressive muscle relaxation, or visualization. These techniques help the person stay calm when facing their fears. 3. Gradual exposure. The central idea of systematic desensitization is gradual exposure to the feared object or situation. This is done in a step-by-step manner, starting with less frightening scenarios and gradually working up to more anxiety-provoking situations. For example, if someone has a fear of dogs, they might start by looking at pictures of dogs before eventually being in the same room with a calm dog. 4. Hierarchy of fears. To facilitate the gradual exposure, a fear hierarchy is created. This is a list of situations related to the fear, ranked from least to most anxiety-provoking. The individual works through this hierarchy at their own pace, starting with the least frightening scenario and progressing to the most intimidating one. 5. Desensitization process. As the individual progresses through their fear hierarchy while practicing relaxation techniques, their anxiety response decreases. Over time, they learn to associate the feared object or situation with relaxation rather than fear. This change in response helps them feel more comfortable with the thing they once feared. Important details. Individual pace. It's essential that each person moves through the systematic desensitization process at their own pace. Rushing through the steps can lead to increased anxiety instead of desensitization. Therapist guidance. While some individuals may practice systematic desensitization on their own, it is often more effective with the guidance of a trained therapist. The therapist can provide support, encouragement, and expertise throughout the process. Effectiveness. Systematic desensitization has been shown to be effective for treating various phobias and anxiety disorders. However, it may not work for everyone, and some individuals may benefit from other therapeutic approaches. Examples to illustrate the concepts. Example with fear of heights. If someone has a fear of heights, their therapist may help them create a fear hierarchy that starts with looking at pictures of tall buildings, then watching videos of people at high places, followed by standing on a low step stool, and eventually working up to standing on a high balcony. Throughout this process, they would use relaxation techniques to manage anxiety. Example with fear of public speaking. A person who fears speaking in front of others might start by practicing speaking in front of a mirror, then moving on to speaking to a friend, and gradually working up to giving a presentation in front of a small group. Each step would be paired with relaxation exercises to help reduce anxiety. Example with fear of dogs. For someone who is afraid of dogs, the therapist might start with showing the person pictures of dogs, then allowing them to watch a dog from a distance, followed by petting a calm dog. As they progress, they would practice relaxation techniques to help ease their anxiety. Summary. Systematic desensitization is a therapeutic technique developed by Joseph Wolpe to help individuals overcome fears and phobias by gradually exposing them to the source of their anxiety in a controlled manner. This process involves learning relaxation techniques, creating a fear hierarchy, and moving through exposure steps at an individual's own pace. By doing so, individuals can learn to associate their fears with relaxation instead of anxiety, leading to reduced fear responses. Understanding systematic desensitization is valuable for anyone studying psychology or preparing for the CPC exam, as it provides effective strategies for managing anxiety and phobias. Negative reinforcement, a simple explanation. What is negative reinforcement? Negative reinforcement is a concept in psychology that refers to a process where behavior is strengthened or increased by removing an unpleasant or aversive stimulus when the behavior occurs. In simple terms, it involves taking away something negative to encourage a desired behavior. It's important to note that negative reinforcement is not the same as punishment. Rather, it's about increasing a behavior by removing something unwanted. Key concepts. 1. Behavior strengthening. The main goal of negative reinforcement is to strengthen a behavior. When a person learns that a certain action leads to the removal of something unpleasant, they are more likely to repeat that action in the future. 2. Aversive stimulus. An aversive stimulus is something that is unpleasant or uncomfortable. This could be anything from loud noises, a bad smell, or even feelings of anxiety. The key is that the stimulus is something the individual wants to avoid. 3. Example of removal. In negative reinforcement, the negative refers to the removal of the aversive stimulus. For example, if a student studies hard to avoid getting a bad grade, the bad grade is the unpleasant stimulus. By studying, the student removes the possibility of receiving a bad grade, which reinforces the studying behavior. 4. Not punishment. It's essential to differentiate negative reinforcement from punishment. Punishment aims to decrease a behavior by adding an unpleasant consequence, while negative reinforcement increases a behavior by removing an unpleasant condition. 5. Real-life applications. Negative reinforcement is often used in various settings, such as education, parenting, and therapy. It helps shape behaviors by encouraging individuals to engage in actions that lead to a more positive experience. Important details. Immediate feedback. For negative reinforcement to be effective, the removal of the aversive stimulus should happen immediately after the desired behavior. This helps the individual make a clear connection between their action and the outcome. Individual differences. What is considered an aversive stimulus can vary from person to person. For example, while one student may find homework stressful, another may not mind it. Understanding individual differences is important when applying negative reinforcement. Long-term effects. Over time, negative reinforcement can help establish habits. For example, if a teenager consistently cleans their room to avoid being nagged by their parents, they may develop a habit of keeping their room tidy as a way to avoid the unpleasant experience of being criticized. Examples to illustrate the concepts. Example in education. A teacher might tell students that if they complete their assignments on time, they won't have to take a difficult test. Here, the difficult test is the aversive stimulus. By completing assignments, students remove the threat of taking the test, reinforcing the behavior of submitting work on time. Example in parenting. A parent might say to their child, "If you finish your chores, you can play video games." In this case, the chores are an unpleasant task, and by completing them, the child removes the unpleasant experience of having to do chores, which encourages them to finish their tasks. Example in therapy. A therapist might help a client who experiences anxiety by teaching them relaxation techniques. If the client practices these techniques and finds that their anxiety decreases, the removal of the anxiety reinforces the behavior of using relaxation techniques. Summary. Negative reinforcement is a psychological concept that increases a behavior by removing an unpleasant or aversive stimulus. It involves strengthening behaviors through the elimination of something undesirable, encouraging individuals to repeat those behaviors in the future. Understanding negative reinforcement is important for anyone studying psychology or preparing for the CPC exam, as it provides valuable insights into behavior modification and conditioning processes. Shaping with successive approximations. A simple explanation. What is shaping with successive approximations? Shaping with successive approximations is a behavioral technique used to teach new behaviors by gradually guiding a person toward the desired behavior. Instead of trying to get a person to perform the complete behavior all at once, shaping involves rewarding small steps or increments that lead to the final goal. This method is often used in education, therapy, and animal training. Key concepts. 1. Behavior modification. Shaping is a method of behavior modification that focuses on reinforcing behaviors that are progressively closer to the target behavior. It helps individuals learn complex behaviors by breaking them down into smaller, manageable parts. 2. Successive approximations. This term refers to the small steps or increments that a person takes toward achieving a desired behavior. Each step is a closer approximation of the final goal. For example, if the goal is to teach a dog to roll over, the trainer might first reward the dog for lying down, then for turning its head, and finally for rolling over completely. 3. Reinforcement. Reinforcement is crucial in shaping. When a person successfully completes a step or approximation, they receive positive reinforcement to encourage them to continue progressing towards the full behavior. This reinforcement makes it more likely that they will repeat the behavior in the future. 4. Gradual progression.